Today our topic is the regions of the upper limb. Axilla. Axilla is actually the pyramid-shaped structure, uh, and it has been shown here the different structure: deltoid, phallic vein, pectoralis major, and clavicle, which actually form the boundaries of the axilla. Like the pyramid, axilla has the four walls or four sides, means the lateral wall, medial wall, posterior wall, and anterior wall, and a base as well as the apex. So these wall as well as the base and the apex is actually formed by the different structure. Like the lateral wall is formed by the intertubercular surface of the humerus, while the medial wall is formed by the serratus anterior and the thoracic wall, and the anterior wall is actually formed by the pectoralis major and the different muscle, and the posterior wall is formed by the subscapularis muscle as well as the teres major muscle, and the apex is formed by the lateral border of the first rib and the posterior border of the clavicle. So we will move to the next slides. Like it has been shown here, the lateral wall of the axilla is formed by the intertubercular sulcus, and the medial wall here is the thoracic wall. Medial wall is formed by the thoracic wall and the stratus anterior, and the posterior wall is formed by the subscapularis, and the superior wall means the apex is formed by the lateral border of the first rib and the posterior border of the clavicle. The overall 3D shape of the axilla, looks slightly like a pyramid. It consists of the four sides and an open apex and a base. What is the significance of the axilla? It allows the passage of several muscles, blood vessels such as the axillary artery and vein, and crucial nerves like the brachial plexus. What is the apex is also known as the axillary inlet. It is formed by the lateral border of the first rib, superior border of the scapula, and the posterior border of the clavicle. Lateral wall is formed by the intertubercular groove of the humerus. Medial wall consists of the serratus anterior and thoracic wall, which includes the ribs and intercostal muscles. While the anterior wall it contains the pectoralis major and the underlying pectoralis minor and subclavius muscle. And the posterior wall is formed by the subscapularis, teres major, and latissimus dorsi muscle. This is the another diagram that has been showing the different boundaries of the axilla. Like the lateral border is formed by the intertubercular sulcus, anterior border is formed by the pectoralis major and pectoralis minor, and the medial border is formed by the serratus anterior and thoracic wall, and the posterior border is formed by the subscapularis, teres major, and latissimus dorsi. While the contents of the axilla, it includes the axillary artery and the axillary vein, as well as the brachial plexus and the axillary lymph nodes and the fat that has not been shown in this pic. And another structure is the axillary tail, which is also labeled as the tail of Spence, is the supralateral extension of the mammary gland. Another region is the cubital fossa. The cubital fossa, it is actually a triangular shaped structure, and the different boundaries are the border of the triangle. Like the medial border is formed by the lateral border of the pronator teres, and the lateral border is formed by the medial border of the brachioradialis muscle, while the superior border is actually formed by the imaginary line between the epicondyles of the humerus. So the boundary is laterally formed by the brachioradialis, medially by the pronator teres muscle, and superiorly an imaginary horizontal line which is connecting the epicondyles of the humerus, while the floor of the cubital fossa is formed by the brachialis muscle and supinator muscle. The contents from the lateral to medial are the radial nerve, bicep radial nerve, bicep brachii tendon, and the brachial artery. You can also remember it from the structure from medial to lateral, like the mnemonic for the medial to lateral is the MBBR. Like from M is the median nerve, B is the brachial artery, and another B is the bicep tendon, and R is the radial nerve. The significance of the cubital fossa, it is used as an anatomical landmark for the identification of the brachial pulse, as well as for performing the important procedures like drawing the blood, inserting the IV catheters, and creation of an AV fistula. You can see in the diagram, like the median cubital vein is actually shown in the region of the cubital fossa, which has been used for drawing the blood as well as inserting the IV catheters. The other structure is also shown in this diagram that has not been a significant for cubital fossa. Another structure is the carpal tunnel. It is actually a tunnel or passageway for the structure that has been passing from your forearm to the hand. And the different structure that has passed through this carpal tunnel is actually the tendons of the different muscles that has been passing from your forearm to the hand. And actually, the tendon has a sheath which is also labeled as a synovial tendon sheath. It lies a tendon only when they where they pass through the narrow passages, as in the palm as well as in the wrist in the carpal tunnel. And the carpal tunnel, the different boundaries of the carpal tunnel is actually the boundaries or the floor is formed by the basically, it is formed by the carpal tunnel, and anteriorly, the carpal tunnel is lined by the uh, transverse carpal ligament. It is also labeled as the flexor retiniculum. You can see in this pic the structure that has been passing through the carpal tunnel. The most important structure is the median nerve, and it has been lined anteriorly. The tunnel is lined by the transverse carpal ligament, and the carpal tunnel, which is space, actually lying under the ligament. And the median nerve is compressed in the carpal tunnel due to the any kind of inflammation or injury in the carpal tunnel or inflammation of the carpal bones. So due to the inflammation, there is a swelling, and due to this, the space is reduced in the carpal tunnel, which leads to the compression of median nerve, and it has the different symptoms. Like the carpal tunnel, it includes the bones, the carpal bones, the trapezium, hamate, capitate, and trapezoid, and the different structure like the tendons of the muscle, flexor ditorum superficialis tendon, flexor pollicis longus tendon, and flexor ditorum profundus tendon. And another structure is the median nerve that pass through the carpal tunnel. And the anterior boundary of the carpal tunnel is formed by the flexor retiniculum. So the boundaries anteriorly is the flexor retiniculum, posteriorly is the carpal bones, and the contents are the, as I have mentioned in the previous diagram, the median nerve, flexor pollicis longus, flexor ditorum profundus, and flexor ditorum superficialis tendons. While the significance of the carpal tunnel, it is the function of the carpal tunnel to provide an anatomical tunnel and protection for various structures that pass from your forearm and into your hand. There are the tendons that connect the muscles to the bone and a nerve that travel through the passageway formed by the carpal tunnel. Symptoms of the carpal tunnel, it is actually due to the compression of the median nerve, like explained in the previous slides. The symptoms are the numbness, tingling, and pain in the thumb, and the pain in the first three fingers of your hand, pain and burning that travel up your arm, the wrist pain at night that interferes with the sleep, and weakness in the muscles of the hand.